I've seen both sides of the show really, like being a patient and then being as a volunteer in the place. So hospitals don't worry me now. That's the real world. Come into the real world. Hospital is the real world. I look at it this way, if it wasn't for this place, I wouldn't be here talking to you now.
Alfred Health is an organisation that looks after 3 hospitals and a number of community sites. So the Alfred is the biggest and most well known. Caulfield is a centre of excellence in rehabilitation, and Sandringham Hospital provides a community with an important local service. And those are supported by a range of mental health and other clinical sites in lots and lots of different places around our community.
It is no surprise that Alfred Health won the Health Service of the Year for 2011. This is a prestigious Victorian Government award, well deserved for its excellence in patient outcomes and its culture to continuous improvement and delivery of high quality care. Alfred Health has got a great culture. The teamwork here, the patient outcomes, the patient-centred focus make this an excellent place to work. I wouldn't want to work anywhere else.
Well, what I'd say to staff members that are coming on board, I would say to them, get involved. Join Alfred Health. Understand that this is a place which has a great culture. It has great support systems. It asks a lot from people who come here. It gives a lot to people who come here. And everybody that joins Alfred Health is a valued part of the whole system. And we believe that the system works because everybody works. Everybody has an opportunity to make suggestions of how we can change to improve the system and make it better. And that doesn't matter whether you think you're down the bottom or up the top of the tree. Every single person has a view, and we value everyone's opinion.
I love the place. I love the challenges, the patient contact, working with the people around me. It's fascinating. It's fascinating me. I learn a lot from this place.
When I came, it was quite clear that the Alfred had a place in the hearts of Melburnians that is different to other hospitals. Now, who knows why that is, but it is very different. So what I think goes on is the coverage that we get for the work we do with trauma victims, the work we did during the recent bushfires in 2009, for example, all leave the hospital with a legacy in the hearts and minds of people who live in the state that is different to the profile that other hospitals have.
Building a good service is all about getting the team right. And we're fortunate here to have the very best team. Our staff are dedicated, compassionate, highly skilled, highly regarded experts who deliver the best possible care.
To work in RICU is a very competitive application process. The people who've gotten jobs, invariably the minority of applicants that we have, and as such it really adds to the quality of people that we have working with us in the team, which contributes significantly to the quality of care that we can give our patients. This ICU exudes an emphasis on quality that means that every time that there's anything to be learned or changed or developed, we'll grab that and run with it, just so that the next patient gets even better care.
Working in the emergency department, which is essentially the front door of the hospital, it is something which we take extremely seriously. We're constantly reviewing cases which may have had less than perfect journeys for the patient, and we're looking at identifying what could have been done in a better way.
We have an outstanding reputation for education and research. We do both undergraduate and postgraduate courses and teaching.
My role is the nurse manager of the Trauma and Orthopaedic Unit, which is 2 West. It's a 44-bed unit that gets all of the high impact trauma and orthopaedics patients from emergency, trauma centre and ICU. I don't think you're ever an expert at leading a team. I think one of my most important things is communicating and involving the staff. They're very used to change and very quick change as well.
We have very high standards at Alfred Health and expect that employees working in our organisation are aware of their codes of practice, their codes of conduct, to ensure that they're delivering the highest standard of care, but also to ensure that we have ultimate safe and quality care for our patients.
I think it's a fantastic place to work. It's dynamic and inspirational. You're working with colleagues that are the best in the world in their business, and so that just makes it an amazingly energetic place to work. My role is manager of redesigning care. It involves getting groups of the staff and patients together here to look at the services we deliver and see how we can deliver them in a better way with better outcomes for the patients, and also where the staff feel happier about the work that they're doing. Alfred Health really delivers on its promise about excellence in care.
So we're considered the model trauma system by the World Health Organisation at the moment. Well, the advantage of this then is that you attract people who want to do the job. There's a relatively young staff, they're enthusiastic, they're flexible, trauma's unpredictable, it's quite nasty, the implications, and people have to be flexible and available and enthusiastic and take responsibility of what they do, make sure that all things are attended to.
It's a privilege to do what we do, even on that very busy day.
I think the exciting thing is that there's so much change at the moment, and that's reflective of technology in general, and it really opens up a lot of opportunities for us to make a difference.
We birth 1,200 babies a year. We are the only service of this kind. We deal with the community in strong links with maternal child health nurse, community support services for women and their families once they go home. So it is very much a community service.
Sandringham's a community hospital, so it offers an emergency department, it offers some community ambulatory care. It allows for people to be treated within their community. We can certainly provide good emergency care and good outpatient care for common childhood medical problems.
I expect new staff to come into the environment with obviously fresh and open eyes, but also I'd like to think that we can learn from them. So I'm very keen to hear about their observations, particularly in the first 3 months, because I think after that time we tend to become acclimatised to what's happening around us. Staff that come into the organisation come with a wealth of clinical experience, but also with a wealth of life experience, and we can learn a lot from that.
Rehabilitation Aged and Community Care is a program that works right across Alfred Health. We have responsibility of services at the Alfred Hospital, Caulfield Hospital and Sandringham Hospital, and what we're trying to do is make sure that all patients have access to rehabilitation and aged care, both in an inpatient setting and a community setting. We have a focus on excellence, trying to help staff increasingly work in an interdisciplinary framework.
There are lots of people that work together to achieve goals for clients. It's much more of a quality of life service. It helps people achieve what they want to do in their life and participate more fully in the community.
I love it when we're able to achieve patient goals that perhaps the interdisciplinary team thought might not be achievable, and it's wonderful to see patients achieve goals and go home.
I know that I'm making a difference in people's lives because the work that we do enables them to return to their previous life roles.
It's a bit like a village in that we all know each other. You walk past people in the corridor and they're always saying hello.
I love working here. I love walking down the halls and knowing people and knowing that everybody's got the same kind of job passion as each other. Everybody's got the same agenda. It's about the patients.
We have a huge role in rehabilitation and also in community services. We try and look at what the future is about and trying to adjust to the needs of a changing population.
We're very lucky to have a health service that has from the acute to the subacute setting and then to the outpatient setting all in one. The communication across all campuses is fantastic. It's fantastic to be part of their journey.
I'm so proud because our outcomes are so good and we actually get the job done and we are helping people every day.
We work with a very committed and passionate group of staff, and that's very encouraging and very inspiring. We work with some fantastic families who, in the face of considerable adversity, are able to achieve some great outcomes. We have a state-of-the-art family interview room where our clinicians can do a lot of behind-the-screen work with families, where they might observe families and then feed back to the families about ideas and strategies for building on the strengths within their family.
We're linked through Alfred Psychiatry, which is a large program, which is mostly adult psychiatry. The crisis team, the inpatient unit, we're all part of the broader Alfred Psychiatry system, although we're responsible for the under 25s. We're very committed to being at the cutting edge of child and youth mental health, and I guess what that means is having interested, excited, enthusiastic staff who are willing to take risks, who are willing to take a chance and do new things, because we are passionate about leading that, putting the clients in the centre and working with their strengths and their abilities to get the most out of their lives.
I think over the last 10 or 11 years now, it's become apparent that Melbourne Sexual Health Centre is a leading light around the world. There was a recent article that described it as one of the leading international sexual health centres that's been driven by efficient and effective services informed by as much as possible information technology. We welcome 40,000 people through the front doors every year.
It's about education, quality service, clients' needs first. We also have an Aboriginal Torres Strait Islander project here.
It's the best place I've ever worked. It allows me to direct my research ideas with and interact with a group of highly motivated individuals who are all focus on the same aim, and that is to provide the Victorian public with the best services that they can get for the money that's entrusted to us.
Well, it was cardiomyopathy. That was the cause of it all. But it was a long, hard, uphill struggle. I couldn't go back to work, and you just never had the energy in your body to do anything until my cardiologist at Box Hill said, well, we're not getting anywhere, we're not making any progress. So he said, I'm going to write to the Alfred to see if you can go on the transplant waiting list. And I think at the time they worked it out. My heart was functioning at 12%. I was admitted middle of June 1992, and I had a heart transplant on the 30th of June 1992. So come July the 1st this year, I commenced my 20th year since I've had the heart transplant. And then from there on in, like the Alfred's become a second home to me.